How does scar tissue form after raw joint surgery? Imagine your body as a busy construction site that repairs itself after an injury. When rheumatoid arthritis damages a joint and surgery is performed to fix or replace it, your body's natural healing process kicks in. This process involves activating cells that produce collagen, a vital protein that forms the foundation of new tissue. Collagen molecules gather together to create a kind of scaffold, similar to bricks and mortar building a wall, which helps close the wound. This scar tissue is essential because it stabilizes the area and promotes healing. However, in some cases, especially with rheumatoid arthritis, this healing response can become overactive. Because raw involves ongoing inflammation and immune system activity, the body may produce too much collagen. This leads to thick, dense bands or sheets of scar tissue forming around the joint. While some scar tissue is normal and necessary, excessive amounts can cause problems. It can make the joint stiff, limit movement, and sometimes lead to a condition called arthrofibrosis, which is a painful restriction of joint motion. Several factors influence how much scar tissue forms after joint surgery. The location of the surgery matters because joints like the knees, shoulders, and elbows move a lot, which can irritate healing tissue and encourage more scar formation. The presence of ongoing inflammation from rheumatoid arthritis can also increase the risk, as the immune system is already in a heightened state. Genetics play a role too. Some people naturally tend to develop more scar tissue during healing. Post-operative care is crucial. If movement is limited after surgery or rehabilitation is delayed, scar tissue buildup can worsen. The way the surgery is performed, including the size and placement of incisions, can also affect scar tissue development. Sometimes, complications like infection can further promote excessive scar formation. When scar tissue becomes problematic, it can cause joint stiffness, pain, and a significant loss of movement, making recovery more difficult. To address this, doctors often recommend physical therapy to keep the joint moving and prevent excessive scar buildup. Devices like continuous passive motion machines can help gently move the joint during healing. In some cases, additional procedures such as arthroscopic surgery may be needed to remove excess scar tissue and restore mobility. Research is ongoing into new treatments that might prevent or break down excessive scar tissue, but these are still in experimental stages. Overall, scar tissue formation after rheumatoid arthritis joint surgery is a complex process influenced by the body's healing response, the level of inflammation, and how well post-operative care is managed. Proper surgical techniques, early mobilization, and personalized rehabilitation plans are key to minimizing problematic scar tissue and helping you regain as much joint function as possible. Always consult your healthcare team for advice tailored to your specific situation, as individual healing can vary widely.